Hello, my name is Clair Naughton and I'm a Regional Development Officer and Diabetes Nurse with Diabetes Ireland. So I'm recording this talk for Galway Public Libraries as part of the Healthy Ireland in Your Library initiative, and I hope you enjoy it. So I work for Diabetes Ireland, and Diabetes Ireland is a national charity set up since the 1960s, and two of our main aims would be to provide support, education, information and motivation to people living with diabetes, their families and carers. And we also would do a lot of work around health promotion and diabetes awareness to raise awareness of diabetes and foster programs for early detection of diabetes and the prevention of type 2 diabetes. So the plan for my session, I'll just talk about what diabetes is, differentiate between the different types of diabetes, talk about signs and symptoms that you may experience prior to being diagnosed with diabetes, risk factors, so there are things that contribute to the development of type 2 diabetes, a little bit about diabetes management, what's involved in that, and about type 2 diabetes prevention. And I suppose at the end of it, you'd ask yourself, is there anything that you can do personally to reduce your personal risk of developing type 2 diabetes in future years? And then for any listeners who have diabetes, I'll talk a little bit about what Diabetes Ireland supports are available to you. So in Ireland, we don't have a register of people with diabetes, but the estimated prevalence is about 266,000 people, and that prevalence has increased and is predicted to increase further. So I think everybody probably knows somebody that is living with diabetes at this stage. So what is diabetes? So diabetes, it's a lifelong condition and it's characterized by high blood glucose levels, and glucose is another name for sugar. And usually what controls the glucose levels in the blood is a hormone called insulin, which we make in our pancreas. So our pancreas is this red organ that's highlighted on this person's abdomen. So when someone has diabetes, they either don't make any insulin at all, or they do make insulin, it's either not enough or the insulin doesn't work effectively. And as a result, the glucose level builds up in the bloodstream and it cannot get to where it's needed in the body to make energy and for heat. So the glucose generally travels in the bloodstream to every cell in the body. But in order for glucose to be used in the cell, we need insulin. So when we talk about insulin, we say it's like a key that opens up every cell in the body. So without insulin to open up every key in every cell in the body, the level of glucose builds up in the bloodstream, which is the wrong place for it to be, and it's associated with certain symptoms. High blood sugar levels are associated with certain symptoms. And long term, we know that high blood glucose levels over many, many years is harmful, and that the high glucose levels can damage certain vital organs and that. So that's why it's so important to diagnose diabetes and manage it, as best as possible from the outset. So different types of diabetes you may have heard of. So type 1 diabetes, type 2 diabetes, pre-diabetes, gestational diabetes, which is diabetes in pregnancy. There would be rarer forms of diabetes, which I won't go into them, but just to mention that, there are many varieties of diabetes outside of just type 1 and type 2 diabetes. So type 1 diabetes is what we call an autoimmune condition. So autoimmune means that the immune system, for reasons we don't fully understand, attacks the insulin producing cells in the body. So a person with type 1 diabetes, their body does not make any insulin, and they need to replace their body's insulin every day with insulin injections, multiple daily injections, every day for life. So type 1 diabetes is not preventable. You can develop it at any age. maybe the majority would be in a young person, so a child, a teenager, a young adult. Of all the people with diabetes, maybe about 10 to 15% of the diabetes population would account for type 1 diabetes. And risk factors, so things that might contribute to type 1 diabetes would be if type 1 diabetes was in the family, or if there was other autoimmune conditions in the family. But often there's no family history, and it just happens out of the blue, and it's a shock to the family in a lot of cases. So the management of type 1 diabetes, you know, it doesn't go undiagnosed. It is associated with symptoms, which I'll outline in a moment. And, you know, usually when a person seeks medical attention and a GP checks their blood glucose level, and, you know, that's enough for the GP to send the individual to hospital where they'd be admitted for assessment and treatment. So basically, if a GP, you know, tests the person's blood glucose just by this simple finger prick blood test, they get a high blood glucose reading, and they can also test the urine, and there'd be things like glucose and ketones in the urine. That's enough information. The GP would send the individual to hospital. It would be considered a medical emergency, and they're generally admitted. And once they're medically stable, they have to, you know, that's when the learning process starts. So they have to learn how to monitor their glucose levels at home by using this finger prick or glucometer. They have to replace their body's insulin with insulin injections. So they'd be taking multiple daily injections of insulin, like this picture third from the top. There are other technologies now which are becoming more prominent, I suppose, for the management of type 1 diabetes. So they are glucose sensors. So the second one from the top is a device called a Libra. So the white sensor is worn on the person's arm, and the sensor is measuring the glucose in around the fluid in between the cells in the body. And if a person wants to get a glucose reading, they physically scan the sensor with a reader device, or they'd have an app on the smartphone, and it gives them their glucose data. So you'd see this advertised on television, actually, because some people would buy it because it's not available to everyone with type 1 diabetes in Ireland. And then other technologies are insulin pumps and continuous glucose monitors. So that's the last picture. So an insulin pump, you know, it's connected to the individual, generally their abdomen, and insulin is being delivered via this small little tubing into a cannula. So it's being delivered continuously. The insulin is being delivered continuously. 24/7, and when a person wants to give insulin for food, they just press a couple of buttons on the pump, and it gives them a precise amount of insulin. And then the continuous glucose monitor, which is this other device that's worn on the abdomen. So again, the continuous glucose monitor, it's measuring the glucose in the fluid in around the cells in the body. And some of the continuous glucose monitors, they're, you know, paired with the insulin pump, and the information is, you know, Bluetooth enabled and wirelessly delivered and things like that. So this level of technology, insulin pumps, continuous glucose monitors, are really helping to reduce the burden of care in type 1 diabetes management. But generally speaking, if somebody, you know, is living with type 1 diabetes, they lead a healthy lifestyle, the same as what would be advised for all of us: healthy balanced diet, regular physical activity, and on a daily basis, they do have to balance the food intake with their activity levels, with their insulin doses, with all the other stresses of daily living. You know, and the aim is to try and keep their glucose levels within normal range, and avoid excessively high blood glucose levels, and avoid low blood glucose levels. So it is very much, you know, like walking a tightrope in between high and low blood glucose levels. There is a lot of decision making every single day for a person living with type 1 diabetes. But in saying that, it is possible to live a healthy, happy, normal life without diabetes holding a person back, but it is a condition that a person needs to manage, you know, all day, every day of their life. Like I said, you can lead a very accomplished life. So one example, Theresa May is obviously the former Prime Minister of the UK, but you know, there'd be many, you know, well-accomplished Irish people as well that you know, achieve extraordinary things while living with type 1 diabetes. Diabetes Ireland, over the last few months, we have been running a type 1 awareness campaign, and the aim of this campaign is to promote awareness of the signs and symptoms of type 1 diabetes, because what we want is that if you recognize these signs and symptoms in yourself or in a family member, that you know it could be diabetes, I need to seek medical attention. And the idea behind the campaign is that type 1 diabetes is diagnosed as early as possible, because we know that in Ireland 5 children a week are diagnosed with type 1 diabetes. But if there is a delay in the diagnosis, so if maybe a person doesn't seek medical attention, that the individual becomes more and more unwell, and sometimes what happens is they're rushed to hospital, and it's an emergency situation, and it's obviously very frightening for everybody, especially if it's a young child. So a delay in a diagnosis of type 1 diabetes can lead to critical illness. So signs and symptoms of type 1 diabetes. So the simple acronym to help remember the signs and symptoms would be our test. It's our test campaign. So T is for thirst, so excessively thirsty. E for reduced energy or tiredness more than normal. S for sudden unexplained weight loss. And T for passing urine excessively. So they're the 4, I suppose, textbook symptoms of type 1 diabetes. So if you recognize these symptoms in a family member, a GP can rule out or confirm type 1 diabetes by doing a simple finger prick blood test. And if that's elevated, it's enough for the GP to send the individual to A&E, and usually they're admitted to hospital for assessment and treatment and management of type 1 diabetes. I suppose just we know from personal stories from families who you know, diabetes has come to their door, that sometimes the symptoms can be vague or misconstrued as something else. So particularly if maybe a child is very small and they're maybe 2 or 3 years of age and they can't verbalize how they're feeling, they're maybe wearing nappies. So often, you know, the passing urine excessively can go unnoticed because the nappies are very absorbent and the child can't explain how they're feeling. So often parents, they know there's something wrong, or maybe they do know the symptoms, but they don't realize that they're potentially type 1 diabetes. So sometimes what happens is, you know, that the family might wait and see and hope and see if the child is going to get better. And then they don't get better, they get worse. And sometimes what happens is they're rushed to hospital and the child needs to go into intensive care or high dependency. And it's, you know, very, very traumatic for the whole family. So that's why we're highlighting these signs and symptoms among families, among childcare workers, schools, because people that spend a lot of time with children, they're well placed to be alert for these symptoms. So another thing would be something like bedwetting in a previously toilet trained child. Parents would notice it's only when, you know, they pick up the child, they realize they're way lighter than they would have expected, or maybe when they're bathing the child, they notice that weight loss, that the child has really, you know, gone to skin and bone. So these are the things that, you know, parents who've been through it tell us that they're things that they recognized. But it's diabetes is very, very easy to diagnose, that literally the GP or the practice nurse just has to do a finger prick blood glucose test, or test a urine sample, and that would be enough. So no other tests would be needed to confirm a diagnosis. That would be enough information for, you know, you to be sent to hospital. So that's our test campaign. So there's lots more information on our test campaign on Diabetes Ireland social media and on our website as well. So you can share that message if you want to. So type 2 diabetes and pre-diabetes. So type 2 diabetes would account for about 85% of the diabetes population. So somebody with type 2 diabetes, their body is making insulin. It's either not enough insulin, or the person is what we call insulin resistant. And insulin resistance is when the body's insulin, you know, isn't doing its job. So type 2 diabetes develops slowly over years. And there are risk factors. So risk factors are things that may contribute to the development of type 2 diabetes. So some of these risk factors are modifiable and some of them aren't modifiable. So risk factors would be the aging process. So type 2 diabetes, I suppose the prevalence increases maybe after about 35 years of age. But it continues to increase the older people get. So over 40, 50, 60, 70, 80, there'd be a higher prevalence of diabetes. If diabetes is in the family, type 2 diabetes in siblings, parents, that's a risk factor. Then modifiable risk factors. So if a person is very sedentary, so they don't do very much physical activity, that would be a risk factor for diabetes. If a person is overweight, particularly overweight for the height, carrying weight around the tummy, that's a risk for type 2 diabetes. Any woman who had gestational diabetes in the past would be a future risk for type 2 diabetes, or anyone on cholesterol medication or blood pressure medication. So anyone who has these risk factors, again, you should get your routine checkup and a routine blood test to screen for diabetes, because it is possible to have type 2 diabetes and not know it. So it would be possible for a person to go undiagnosed with diabetes, be walking around with it and not have the symptoms. So the reason why type 2 can go undiagnosed and not type 1 is because type 2, the glucose level in the blood can be high enough that we can say this person has diabetes, but it's not high enough to cause those symptoms of thirst, passing urine, weight loss, things like that. So the message is that if you are someone who has these risk factors over 35, 40 with family history of diabetes, high blood pressure, high cholesterol, gestational diabetes, that you would get your routine checkup done with your GP for your routine blood tests. And I suppose to take action for the modifiable risk factors. So to make sure that you are physically active regularly, that you'd have a healthy balanced diet, that you'd be aware of what the recommendations would be for somebody, because we know that type 2 diabetes is preventable in almost 60% of cases by purely those healthy lifestyle, taking action with those healthy lifestyle changes. So just in terms of, whether a person can put type 2 diabetes into remission, that I've already mentioned that we know type 2 diabetes is preventable in about 60% of cases, and that's been demonstrated through many diabetes prevention studies internationally. And the healthy eating, regular exercise, weight management is very much cornerstone for the prevention of type 2 diabetes and the management of type 2 diabetes. If you want to learn more about whether it's possible to put type 2 diabetes into remission, you can look up, there's a study in the UK known as the DIRECT study, and this is the website for it. So it showed that some people managed to put their type 2 diabetes into remission by losing weight, particularly losing weight around their abdomen. But the weight loss, achieving the weight loss and maintaining the weight loss was critical to success. Again, just to mention that not everyone with type 2 diabetes is actually overweight. So it just depends on where you're starting from. So if you're somebody who's type 2 diabetes and there's lots of room for change with your lifestyle and you have weight to lose, and you lose weight, you exercise, you take action, you make healthy lifestyle changes, potentially you could put diabetes into remission. It's not possible for everyone because of the non-modifiable risk factors like age, family history, gestational diabetes, etc. So, you know, all you can do is your very best in terms of those healthy lifestyle changes, and, you know, keep in contact with your GP. Like everyone with diabetes would have like 2 medical checkups every year to make sure that their diabetes is being well managed. So I'll talk a little bit more about that in a minute. So other forms of diabetes, so gestational diabetes is diabetes that develops during pregnancy. It generally goes away when the baby is born. It is a condition that's routinely screened for in pregnancy, particularly if the mother has additional risk factors, such as an older mother or a mother who has had a family history of diabetes, or maybe they've high blood pressure, they're overweight, things like that. So any woman who has had gestational diabetes, it is a future risk for type 2 diabetes. So anyone who's had gestational diabetes, it's advised that you have annual blood tests to make sure that you haven't developed type 2 diabetes. And it's very important, again, to take action with those healthy eating, exercise, weight management to reduce your future risk for type 2 diabetes. So other sort of rarer forms of diabetes, there'd be MODY diabetes, LADA, cystic fibrosis related diabetes, or sometimes people develop diabetes secondary to another condition. So it could be secondary to something like pancreatitis, or you know, long-term use of steroids, for example, again for another health condition. So it's just to mention that there would be other forms of diabetes out apart from the ones that would be well known. So signs and symptoms of type 2 diabetes. So like I was saying, it is possible to have type 2 diabetes and not know it, because the glucose levels can be high enough that they're in the diabetes range, but not high enough to cause symptoms. So symptoms would be, if they are present, would be tiredness more than normal, thirst more than normal, passing urine more than normal, blurred vision, unexplained weight loss, and sometimes there might be infections such as thrush or any infection that isn't going away, because the infection can thrive off the high blood glucose levels. So a common one we would see is somebody may have thrush. Anyone can develop thrush, but if the thrush is persistent, it's not responding to normal treatment, and it's reoccurring, it could be that there is diabetes that's undiagnosed there, and the infection is feeding off the high sugars in the blood there. So that's often how it's picked up. But in a lot of cases, I speak to people every day that would just get routine bloods done just to get a checkup, and they, you know, they're notified that they have diabetes and they've no symptoms whatsoever. So that's why the routine screening is really important, and getting those all important checkups and routine bloods done with the GP every couple of years, the same way as you NCT your car every couple of years, you should, you know, get a bit of a checkup yourself with your GP and your practice nurse. So diabetes is diagnosed very easily by a routine blood test. So there is a couple of blood tests. So there'd be a fasting blood test to check the level of glucose in the blood. So often that might be the first one that's done. And if that's elevated, then an additional test, there's another blood test called a HbA1c blood test, which if it was taken today, it reflects the previous 3 months of blood glucose levels. The HbA1c can be used to diagnose diabetes, but it's also used to measure, you know, if diabetes is well controlled or not. So it's a routine test for anyone with diabetes, that the HbA1c would be done every, you know, at least twice a year, because it gives the doctor a long-term picture, and because it reflects the average blood glucose over the previous 3 months. So again, all of us over the age of 35, we should be getting our routine checkups and blood tests done. But even younger than that, if somebody has additional risk factors for diabetes, such as being overweight or having a family history or a history of gestational diabetes, the testing for diabetes can start at any age. So the reason why we need to diagnose diabetes and manage it from the outset is because, like I've mentioned already, long-term high blood glucose levels can cause certain diabetes complications. And I suppose coupled with high blood glucose levels, so whether that's undiagnosed diabetes or maybe poorly managed diabetes over many, many years, other risk factors for complications would be if a person had uncontrolled high blood pressure, uncontrolled high cholesterol, and if they smoked, for example, all these things lead to diabetes complications. So when someone has diabetes, it's really important that their glucose levels are controlled, their cholesterol is under control, their blood pressure, and they don't smoke, and that they lead that healthy lifestyle that I've mentioned. But the potential complications would be eye disease, heart disease, kidney disease, and foot disease. And I suppose the thing is, again, the complications are largely preventable through good diabetes management. And everyone, when they're diagnosed with diabetes, they're automatically screened for these complications of diabetes. So, for example, there is a national screening service for eye disease called Diabetic Retina Screen. So everyone with diabetes over the age of 12 would attend for annual eye screening. But if, some people then might be called every 2 years if their eyes are good and they're considered at low risk of developing eye disease. That the heart would be screened by making sure the cholesterol and the blood pressure are controlled. The kidneys are checked by a routine kidney blood test and a urine sample. And then everyone with diabetes should have a foot assessment by a health professional once a year. So the health professional could be the practice nurse, it could be the GP, it could be someone from the diabetes clinic, a podiatrist. So with the feet, what they're checking for is circulation and sensation, because they're the two things that can potentially be affected by diabetes. So I suppose as just to reassure anyone that those complications are largely preventable, and by going for your routine checkups for your diabetes, you're automatically being screened for these complications, so that if complications are going to occur, that they're detected at the earliest opportunity and they're treated to prevent any progression. So for example, kidney disease, it wouldn't have any symptoms in the early stages, but it can be detected with a routine urine and blood test. Similarly, eye disease, no symptoms in the early stages, but it can be detected by getting those eye exams and the eye photographs taken as part of the national screening program for diabetic eye disease. And also by, again, the self-management tasks every day that, a person with diabetes, those decisions around healthy eating, regular exercise, weight management, maybe taking prescribed medication, testing the blood glucose levels. And if the blood glucose levels are very high at home, that, you phone up whoever is looking after your diabetes to get some advice, or maybe the medication needs to be reviewed. All that kind of stuff. So the aim of diabetes management is to, have as normal blood glucose levels as possible, so that, a person doesn't have those symptoms of high blood sugar level, like the thirst, the tiredness, the weight loss, blurred vision, things like that. But also that their long-term health is protected and they don't run into complications of diabetes. So daily diabetes management tasks, are the healthy eating, regular exercise, weight management, testing glucose levels, medication. For anyone diagnosed with diabetes, they should get some education about how to manage diabetes every day. So there would be, say, free group education courses for people with type 2 diabetes, for example, and I'll talk a bit more about those. A person with type 1 diabetes, they're supported throughout the lifespan of their lifespan, and through the different stages of life. They'd be supported by their multidisciplinary diabetes team for that ongoing education, so that they're doing their very best to manage their diabetes every single day. So generally speaking, everyone with diabetes would have 2 appointments a year for those routine blood tests and blood pressure monitoring and the annual screening for complications of diabetes, to ensure that if any complications are going to occur, that they're detected at the earliest opportunity, and that interventions take place to stop a situation where they progress and somebody ends up maybe visually impaired from diabetes, or they end up with, end-stage chronic kidney disease or something like that. So it's all about protecting a person's health long term and ensuring that, on a day-to-day basis, that diabetes isn't stopping the individual from doing anything that they want to do. So diabetes prevention. So it's only type 2 diabetes that can be prevented. I should have popped that on my slide. So type 1 diabetes isn't preventable. It's autoimmune. If you had a crystal ball to tell you next week you'd develop type 1 diabetes, you couldn't do anything to prevent it. But type 2 diabetes, we know it's preventable in almost 60% of cases. There's many international diabetes prevention studies to demonstrate that. So it's a healthy, balanced diet, regular physical activity, aiming to have a weight appropriate for your height, trying to avoid that weight gain around the middle. If you drink alcohol, just know what the recommended intake is for alcohol and don't exceed that. So just enjoy alcohol in moderation, and not to smoke. So smoking is a risk factor for heart disease. If a person has diabetes, that's also a risk for heart disease. So diabetes and smoking would be, a really bad combination, because it really increases the future risk for heart disease and strokes. So in terms of what is a healthy, balanced diet, so whether you're trying to prevent diabetes or manage diabetes, the advice would be very similar, and it would be focused around the healthy eating guidelines for all adults. So the food pyramid that you might be aware of. So when someone has pre-diabetes or type 2 diabetes, there's a couple of things that we would usually highlight. So we usually talk about, well, they need to know the foods that are broken down into glucose in the body, and they need to be careful about the amounts of those foods that they're eating, particularly in one sitting. So foods that are broken down into glucose would be the starchy carbohydrates. So these foods on the second last shelf of the food pyramid. So all your bread, pasta, rice, potato, cereal. But we need these foods for heat and energy. They are part of a healthy, balanced diet, but the amount that we eat across the day is important. So, looking at the food pyramid, on the bottom corner here, there is a daily serving guide for your starch carbohydrates. So you can see it depends on the level of physical activity, the gender, and the age. So you look at that table and you decide where you are. So basically, if you're active male, maybe between 19 and 50, so somebody who's 25, male, very active, they could have up to 7 servings of starchy carbohydrate a day. Whereas if somebody is inactive, female, over 51, they should only have 3 servings of starchy carbohydrate in the day. And the other thing to be aware of is, what is a serving of starchy carbohydrate? So 2 slices of bread would be a serving, 2 medium potatoes would be a serving, a 200 ml cup filled with cooked pasta, cooked rice, mashed potato is a serving. So I suppose just to study the food pyramid and know firstly what is a serving, and that you are very aware of the amount of food that you're cooking and the amount of food that you're putting out on the plate, and that you're not exceeding, that you're not having multiple portions in one sitting from the starchy carbohydrate shelf. So I suppose it's just to have really an awareness. And we'd also recommend the whole grain, whole meal varieties of, say, bread, pasta, rice, and the high fiber would be healthier choices as well. In terms of the vegetable, salad and fruit shelf, you know, 5 to 7 servings from this shelf, just for a person with pre-diabetes or type 2 diabetes. They do need to be cautious of fruit portions because of the natural sugar content in fruit. So for someone with pre-diabetes or type 2 diabetes, you know, we'd say don't exceed 2 to 3 servings of fruit in the day. And again, to know what's a serving of fruit. So a small banana is a serving, an apple is a serving, an orange is a serving, maybe smaller fruits like kiwis and plums, you know, mandarin oranges, 2 would be considered a serving. So again, it's just for a person with type 2 diabetes or pre-diabetes, there wouldn't be a limit with salad, vegetables, but just the fruit intake. The advice is 1 piece of fruit at a time, maximum of 2 to 3 servings across the day. Just the other considerations, I suppose we would also, you know, if somebody is watching their weight or watching their cholesterol, they'd be, you know, reducing their saturated fat intake. And, you know, even if they are having like low fat options of maybe butter and milk and cheese and things like that, the portion would be watched as well because of the you know, the calorie content. With your meats and proteins and things like that, choose lean meats, cook them in a healthy way, cut the fat off meat, cut the skin off chicken, avoid processed meats. The top shelf of the food pyramid then, which is all your lovely treat foods, so your cakes, sweets, biscuits, crisps, soft drinks. So you can see the top shelf is actually physically removed from the pyramid because these foods have very little nutritional benefit, and Healthy Ireland surveys have showed over the years that, you know, the average Irish person is consuming multiple treats and snacks from this top shelf, so every day. So the recommendation is to enjoy a treat once or twice a week, and a portion would be about 100 calories. So 100 calories is about 4 squares of chocolate. So to look, usually on biscuits and chocolate, it tells you, you know, be treat wise, and it tells you what portion is equivalent to 100 calories. So I suppose it's just something to be mindful of, again, when you're you know, having your treat, that you're not eating excessive amounts in one sitting or multiple treats in one day, because they're full of sugar, saturated fat and salt. Again, a person with diabetes, the treat advice is the same, a very small amount, maximum once or twice a week. We don't recommend diabetic chocolate or biscuits or anything like that, because it probably would have a lot of artificial sweetener, a lot of saturated fat. It can be expensive. So a small amount of a regular, you know, plainer option would be better. I suppose keeping hydrated is really important as well, keeping active, and the alcohol in moderation is really important as well. So in terms of physical activity, so the recommended physical activity for all adults would be 30 minutes of moderate physical activity 5 days a week or similar. If you're trying to lose weight or maintain weight loss, it would be double that, so 60 minutes 5 days a week or similar. It doesn't have to be all in one go, so it doesn't have to be 30 minutes or 60 minutes in one go. The 10 minutes, 15 minutes, multiple bouts of shorter exercise duration, it all adds up. So it's all helpful. It would also be recommended for adults to include activities that increase muscular strength, flexibility and balance on 2 to 3 days a week. For a person with diabetes, physical activity is really, again, cornerstone for the management of type 2 diabetes. It would be prescribed. And what physical activity does is it helps the body's insulin work better. So it really helps to control glucose levels. Someone with type 1 diabetes, again, when they're physically active, which would be really important for everybody, but they do need to balance insulin dose food intake with physical activity to avoid their blood glucose level going too low. So there's many, many benefits to physical activity, which too many to mention, but I suppose many physical health benefits, whether that is getting your cholesterol down, your blood pressure down, your blood glucose down, your flexibility, muscle strengthening, balance, helps with weight management, huge benefits for mental health as well. You know, your circulation, sleep quality, it might be how we socialize as well, with exercise, especially over the last 2 years. So, you know, again, too many to list, but I can't emphasize the benefits enough, really. Again, it would be a good idea to use like technology to help with promoting physical activity. So there would be wearable fitness devices like that counts your steps, that monitors your heart. You can set goals for yourself. So similar apps on the phone, and a lot of them would be free. Again, you can set a goal for yourself, and your watch or your phone can prompt you to, you know, help you to achieve your goal. So if you set your goal of 30 minutes, 5 days a week of moderate physical activity, and you know, using the smartphone and the watches, it tracks your physical activity. And as I said, it might vibrate or alert telling you to get more steps in the day, or, you know, you're nearly at your goal, just go for that extra walk or whatever it is to try and, you know, reach your target, whether your target is, you know, 10,000 steps in a day, or is it your 150 minutes of physical activity across the week. So again, I suppose that the goal setting with physical activity would be individual as well, depending on where you're starting from. If you're unfit and you don't do any physical activity, you'd start off slowly and build on it. So I suppose when we're talking about physical activity, we do say to people to, you know, set a goal for yourself, look at barriers to physical activity and explore solutions to help you to achieve your physical activity goals. So it may be that you need the support of a family member or a friend, or you need to join another group to help, that if you're not going to be motivated, you feel to do the physical activity by yourself. I suppose a couple of other measurements would be to know if you are a normal weight for your height, and that would be to know what your body mass index is. So we know that if your body mass index is more than 25, it would be in the overweight category, and that would increase your risk for type 2 diabetes. And then if the body mass index increases by 5 kilograms per meter squared, the risk of having undiagnosed diabetes increases by 89%. So to work out your body mass index, if you know what weight you are, you know what height you are, you just go into your phone, put in BMI calculator, and you put in your weight, put in your height, and then it calculates it, and it tells you if you're normal, overweight, obese, morbidly obese, etc. I suppose another important measurement is to know what your waist circumference is. So the waist circumference, it's not the waist of your trousers. So it would be the waist circumference, your tummy that comes out over the top of the trousers. So around about where your belly button is. What's the circumference of your waist there? So generally it's between the bottom rib and your hip, where the belly button is. That pop a tape measure around your waist, and to measure in inches, a woman's waist circumference should be less than 32 inches and a man's waist circumference should be less than 37 inches. And again, just to reiterate, it's not the waist of your trousers, because often the waist circumference would be greater than the waist of the trousers, especially if you're carrying extra weight around the tummy. So the World Health Organization would say carrying extra weight around the middle increases the risk for type 2 diabetes, heart disease, and certain cancers. So we know that in Ireland, only half the people in Ireland have a normal waist circumference, and obesity is on a par with smoking as being the biggest preventable cause of death. So I suppose just in summary, just based on what I'm saying, do you have the risk factors for type 2 diabetes? If you feel you have the modifiable risk factors, so if you feel you could be doing a bit better with the healthy eating side of it, or you really need to increase your physical activity, just I suppose to put a bit of a plan in place for yourself to make small little changes that'll all add up. To know, you know, if you haven't weighed yourself, dust off the weighing scales, know if you are a normal weight for your height, measure your waist circumference to know, you know, could you do with losing a bit of weight around your tummy? Could you do with increasing your physical activity? You know, are there lots of unhealthy options that have kind of crept into the house in terms of your diet? Are there changes that can be made there for the greater good? What's your alcohol intake like, and does it exceed what's recommended for you? And then the routine checkups with the GP would be important as well. So for most of us, every couple of years would be fine. But then if you are diagnosed with diabetes or another you know, heart disease or something like that, probably twice a year would be, you'd go for the routine checkups. But I suppose your GP would advise how often you should attend for the checkups, depending on your individual circumstances. But again, it's just to reiterate that it is possible to have type 2 diabetes and not realize it. So the blood test is important. Equally, you could have high cholesterol and the body wouldn't necessarily warn you. So those routine blood tests are vital. So anyone who is living with diabetes, just to highlight some of the Diabetes Ireland supports that are available. So we do have a website, we do have literature, we do host regular webinars, which would be a 1-hour talk delivered virtually on a variety of topics for people with diabetes. So some would be for people with type 2 diabetes, some would be for people with type 1 or parents of children with diabetes. There would be free group education courses for people with type 2 diabetes, and that it's called structured education. They'd be HSE funded, they'd be free to attend. So everybody with type 2 diabetes should, you know, attend structured education. So the courses that are available for people with type 2 diabetes at the moment, there's one called CODE, which is Diabetes Ireland Structured Education. There's one called Desmond, and there's another course called Discover Diabetes. So either one of those 3 courses would be perfect for anyone diagnosed with type 2 diabetes, because we'd cover all aspects of diabetes self-management as part of the course. They're delivered in a group, so you meet others in the same situation as yourself. So Diabetes Ireland, we have a website which is there. We have a helpline, which would be Monday to Friday 9 to 5. So we have a telephone number and an email address. So if you know of anybody, maybe in your work or a next door neighbour who is diagnosed with diabetes, certainly send them our way, because we can provide reassurance and we can give just information that a person needs when they're starting off on their diabetes journey. Because I think when you're diagnosed with any, you know, a long-term health condition, it's very overwhelming, and sometimes people go into the internet and they become very overwhelmed, or else they'd be reading information that isn't evidence-based. So certainly having a conversation with one of the health professionals in Diabetes Ireland or going on to our website would be a good place to start. There'd be many options. Also, I'll show those in a minute. Many health resources as part of the Healthy Ireland in Your Library collection as well. Just two more things that would be, I mentioned the group education course facilitated by Diabetes Ireland. It's called Code and it's free. And there's information on the Diabetes Ireland website where you can register your interest, or you can pick up the phone and speak to somebody and give us your details. We don't have a waiting list, and we run a minimum of 3 of those every month on Zoom at the moment. And then the other thing, this would be an online module on the Diabetes Ireland website called Diabetes Smart. And this is, again, covers all aspects of living with type 2 diabetes. It's free to do. You do need to register with, you know, an email address just to set up a username and password. And the only reason you need to do that is because you don't need to do the whole module in one sitting, that you can do it at your own pace. So you might need to do 10 minutes and then you might have had enough. You come back to it on another day, and it brings you in where you finished. It doesn't make you come back to the start again. So it remembers your login details. So that's called Diabetes Smart, an online module that anyone can do at their own pace at any time at home. And again, it's free. And I've already mentioned the Healthy Ireland in Your Library. So again, I'm sure the librarian would give you a steer and you know, link you in with health resources. And that's it from me. So at this stage, I would open the floor to questions, but obviously, as it's virtual, that's not possible and it's recorded, but I would be happy to hear from anyone. So my name's Clair Naughton and I'm a diabetes nurse with Diabetes Ireland, but equally my other health professional colleagues, we'd be happy to answer any questions if anybody wants to get in touch with us. So I leave you with our phone number and our email address and our website. And thank you for your attention. I hope it was enjoyable for you. Bye now.